much depends on what's injured we take care of.
All right. And what about the removal of a bullet? Do you do that?
Yes, sir.
Okay. Can you briefly describe your educational background that allows you to do what you did?
Sure. I went to college, Boston State University. Got a degree in chemistry. From there, I went to the Medical College of Georgia, and I went to medical school for 4 years, and then I did my internship year at University of Florida for basic general surgery internship, and then went to the Medical College of Georgia and did a 5-year general surgery residency there.
And what is your specialty as far as in terms of your practice of medicine?
I'm a general surgeon. I'm a board-certified general surgeon.
All right. And do you hold any licenses, professional licenses?
I do. I have a medical license from the state of Georgia, and then I'm also board-certified in general surgery through the American College of Surgeons.
And are you currently a member in good standing?
Yes, I am.
And do you belong to any professional organizations?
Yes, sir.
And what are those?
Medical College of Surgeons. I belong to the Moret Society, which is a society through the Medical College of Georgia, American Medical Association, American Society of Breast Surgeons. There's several different organizations that we go to. A lot of them depends on what meetings and continuing medical education seminars we go to as some of the memberships we're associated with.
Have you published any medical articles?
Not since my residency. I did a year of research and published during that time, but I have not done any since I've been in private practice the last 13 years.
With regard to your experience, how long have you been doing it?
I finished my residency 13 years ago, and I've been in private practice here in Athens for just about, coming up this month, 13 years.
And just as a range or an estimate, can you estimate approximately how many surgeries you performed in that time?
Good question. It'd be in the thousands. I couldn't tell you exactly.
Okay, thank you. Now, have you ever testified as an expert before?
I have.
And tell us about that.
I was a surgeon involved in a car accident where a gentleman was injured pretty severely, and I was brought to testify on what his injuries were.
All right. And what field or area of expertise were you qualified as an expert?
As a general surgeon doing trauma.
Your Honor, at this time, the state would tender Dr. Webb as an expert in the field of general surgery as well as trauma.
Any objection?
No, sir, Your Honor.
The witness will be allowed to testify as an expert in the area of general surgery and trauma.
Thank you. I want to take you back to March 22nd, 2011. And were you working at Athens Regional on that particular day?
Yes, sir, I was.
And did you have an occasion to treat and be the admitting physician for an Officer Tony Allen?
Yes, sir, I did.
Can you tell the jury how you became involved with this patient and what sort of occurred initially?
Sure. I was the surgeon on call for trauma that day. I was actually in my office that whenever they called me and said that there was a trauma alert and that I needed to come to the emergency room, that there had been a gunshot wound. That's all the information I had at that time. My office is just a couple blocks down Prince Avenue from the hospital, so it didn't take me too long to get there. But I pretty much was called in, and Officer Howard was already in the emergency room at that time being treated by the emergency room staff. That's when I was introduced to the case at that time.
All right. And with regard to the medical records, does it indicate whether you're the admitting physician?
Yes, sir, I was the admitting physician.
And can you explain to the jury what the role is of the admitting physician?
Sure. as a general surgeon, there's, when we're involved with trauma, there's usually a lot of different injuries that can be involved, and a lot of them that us as general surgeons don't handle, but there's a lot of different physicians involved. So whenever there's a trauma that involves more than one organ system, they get the general surgeons involved. And even if it's something we don't take care of, we become coordinators of that case. So if somebody comes in with a head injury and a broken bone, then I may have to call in a neurosurgeon and an orthopedic surgeon. It's my job to coordinate between those two different doctors what the care is for that particular patient, but I'm the admitting doctor, and I'm responsible for pretty much directing what care that patient gets, what doctors are involved, and approving what treatments that they have.
And in this role as the admitting physician or coordinator, are you familiar with all aspects of the patient's case?
Yes, sir.
And did you have an opportunity to review x-rays and CT scans?
Yes, sir.
I would like for you to view States Exhibits 175, 176, 177, 178, and 179. With respect to States Exhibit 175, 176, and 177, the CDs.
Yes, sir.
Do these CDs contain all of the patient's CT scans and x-rays and other photographic evidence?
They do. They include the regular x-rays, the CT scans, and the CT arteriogram that was done.
And you reviewed these CT scans and the x-rays?
I have reviewed them prior to coming here, and I looked at 2 of the 3 discs this morning to verify that they were accurate.
Okay. Are they accurate?
They are accurate, yes, sir.
Your Honor, state moves to tender States Exhibits 175, 176, 177.
Any objection?
No, sir, Your Honor.
They're admitted.
Now, with respect to States Exhibits 178 and 179, do they also fairly and accurately portray specific x-rays of Officer Tony Allen?
They do, yes, sir.
And what are the x-rays depicting?
You're talking about those right there?
Yes, sir.
Those are basically scout films, which are plain films done prior to CT scans that give an overview of the areas that are going to be taken into the CAT scanner to look at. So you're seeing a plain film x-ray of the patient's basically head, neck, and shoulder area where the 2 injuries are at. You can actually see one of the bullets in the x-ray.
And at this time, we'd like to publish States Exhibits 178 and 179.
Those have been.
Oh, I'm sorry. First, I need to tender those in that.
Any objection?
No, sir, Your Honor.
They're admitted.
Gunner, I have the hold on. 178 simply a smaller version of 179?
Yes, sir.
Okay. Doctor, can you see that on the screen? States Exhibit 178.
Yes, sir, I can.
All right. Can you tell us what this particular X-ray is depicting? And there is a laser pointer, I believe, up there.
Right here? Okay. Again, this is the scaled image. This shows the patient's head and face, shoulders, thoracic cavity right here. You got his left and right shoulder. And what you see here is you see a bullet or a foreign body here in the right shoulder, right there.
And can you, do you recall specifically where that bullet was located prior to your removal?
I do. Actually, this is an X-ray image, so this is radio opaque, so it's hard to tell if this is in the front or in the back. This is actually in the back portion of his shoulder on the right side, right there. But obviously, this is a two-dimensional image, so you can't tell the depth of that. But that was actually in the back of the shoulder.
Now, I see what looks like wires and stuff around the chest area. What are we looking at there?
Talking about these wires right here?
Yes, sir.
These are telemetry wires. This is things hooked up to the patient's chest to monitor his vital signs while he's in the emergency department. So this gives us his heart rate and his heart tracings right here, these particular wires.
Okay. So those are on the outside of the body. Those aren't.
That's correct. Those are on the outside, on the anterior aspect of the chest.
And can you tell when this particular X-ray was taken, the date and the time?
Let's see. We got March 22nd, 2011 right here. And there should be a timestamp somewhere. I guess 14/17. Actually, I don't know if that's the time. I think that's the time right there.
So in military time, 14/17, what is that?
It'd be 2:17 p.m.
And the right side of States Exhibit 178, what is this X-ray depict?
This is just a lateral image. Since this is a two-dimensional image, we take them in two different locations to give us a better understanding of where things are. If you were to look at just this particular image right here, you wouldn't know if this bullet was on the left or the right-hand side because it's radio. Well, it's radio opaque, so it's gonna show when the X-ray beams hit that, it's gonna reflect a lot more, and it's gonna be real bright. So it's gonna show more than anything else. So you're not gonna see any other structures other than that metal piece right there. And so there's no way of determining if that's on the left or the right-hand side from where it's located in this particular image. So that's why we have the other image to be able to tell where it is in relationship. But what this does is this gives us the depth from front to back of where that bullet is. You can't tell that on the other image. So if you add this image and the other image, you can sort of in your mind plot where this bullet would be in a three-dimensional view.
All right. And is there bandaging or something going on the left side of the body?
Yes, sir. You see this little rough texture right here? That's actually gauze and bandages. The entrance wound was on the left side where the bullet went in and tracked all the way over to the right side, and that's where the bullet lodged, was on the right side, but the entry site was on the left side, and there was a good bit of bleeding coming from this side, so it was bandaged up to control the bleeding.
Oh, and I neglected to ask you the date and time of this particular X-ray.
Which is the same date and time. It's March 22nd, 2011 at 14:17 or 2:17 p.m.
And this is Officer Allen.
That is correct. Officer Tony Harrison Howard.
And just to make perfectly clear, how many bullets did you observe in these X-rays?
In this X-ray, just one bullet.
Okay. And again, that was located in the back.
Correct. On the right-hand side, back right-hand side. Yes, sir.
Thank you. again, the lights.
Lights.
Now, at some point, were you providing consultation to the emergency room staff?
Yes, sir, I was.
And what sort of consultation were you providing?
Um, the biggest thing, I was in communication with the emergency room doctor, and we were assessing what the injuries were. Sort of the biggest job I have is to provide my expertise and what I feel like the injuries are, whether this is something that I can take care of myself or whether I need to call in any consultants in at that time. And then of all trauma care, we have our basically our ABCs, which is A is airway, B that they're breathing, and C stands for circulatory system, means that their blood pressure, heart rate, and all that are under control. And so Officer Howard had 2 injuries, one to the side of his face and one back of his shoulder. To be honest, the one we were worried the most about was the one in the face.
And what were the specific injuries with respect to the face?
The face, he was shot on the left side of the face as well. He had an entry site that was near sort of the top part of your jawbone right here, below the ear on the front. There was an entry wound into there, and then there was another injury on the other side. It looked like it was an exit wound, and so he had a lot of problems breathing through his nose. He was able to breathe through his mouth, so we felt like that his airway was intact, that he was able to breathe, that everything was open. But we were worried about the injuries that between this track and this track, if it would compromise his airway, his ability to breathe.
And were you able to determine if there were any fractures?
Yes, that was, he went to the CT scanner, and that was to assess injuries that we could not see. Again, you could, the injury on the shoulder, you could almost see the track of where the bullet went, but that didn't mean that it could have ricocheted or gone somewhere into the thoracic cavity. He didn't have any evidence of injuries to his thoracic cavity. We needed to make sure that was not the case. So we sent him to the CAT scanner, and we CT scanned his head, his face, his neck, his chest, and then they went ahead and did the abdomen and pelvis as well, just to make sure that, so basically from the top of his head all the way down to the tops of his legs. And then also we did another study of his neck, which is called a CT angiography, which is a special study to assess the blood vessels within the face and the neck to make sure there was no vital arteries that were injured that could be causing bleeding or blood clots that could lead to a stroke.
And with regard to the facial injury, do you recall if there were any fractures?
Yes. There was basically there was a fracture to the top of his jawbone, which is the mandible. There was a fracture to his cheekbone. There was a fracture to his sinuses on the left hand, the maxillary sinuses, and then the septum that goes between your nose was deviated as well on that side. So there was multiple facial fractures along that side.
Now you're pointing to the right side of your face.
Well, I'm at the left side.
Okay.
Left side, yes. Left side.
And were there any notable injuries to his ears, inner ears?
On physical exam, we couldn't tell this on CAT scanner, but he actually had a ruptured eardrum on the left side.
On the left side.
Yes, he had a little bit of blood on the right side, but the eardrum appeared to be intact.
And well, let me ask you this, was there any sign that the projectile itself struck the eardrum?
There was no evidence looking at the track that the bullet took on the CT scan. This was an injury either due to the force of the bullet hitting the area, or it could have been from the sound from the gunshot itself.
So if a shooter were extremely close, even the sound can rupture?
That's correct.
Okay. And with regard to the injury to the back, that dragged across the back, were there any notable injuries caused by that bullet back?
The majority of the injuries were to muscle and the tissues between the skin and the muscles. It tracked all the way across there. There were some unnamed vessels that were injured that were very small vessels. So he had some bleeding in the area. It looked like maybe one of the spinous processes, which is a little tip coming off of the thoracic vertebra that the muscle's attached to, that maybe the very tip of that could have gotten fractured a little bit. There's really no treatment for that. It's a very minor injury, but that just shows where the bullet went through that area. So you're looking at mostly muscle injury, and then it lodged on the other side of the shoulder, just up underneath the skin.
Thank you, Doctor. Now, at some point, was there a decision made that some sort of surgical intervention was necessary?
Yeah, as soon as we found out there were facial fractures, that's outside of what I treat, so we called one of the oral surgeons to come in. He came in and assessed the patient and felt like that these were open fractures because the skin had been open, so they were open fractures. So you always worry about infection and you worry about bleeding. Another thing we were worried about was his airway. If we didn't get control of the bleeding, then he'd have to lose the ability to breathe on his own and may have to get a breathing tube. So the oral surgeon elected to take him to the operating room to wash the fractures out and to pack the nasal area where some of the bleeding was to help control the bleeding.
All right. And was this the first procedure done?
That was the first procedure performed, yes, sir.
And do you recall when that was performed?
I believe that was done on the day of the injury.
Okay. Now, was there a second surgical procedure?
Yes, sir, there was.
And can you describe that?
The second day after surgery, we put Officer Howard in the intensive care unit to observe him, again, mainly to make sure that he was able to breathe okay. He was in an environment where if he ever had any problems, we had staff immediately readily available to be able to take care of that. Versus being in a regular hospital room, there's not staff there 24 hours a day monitoring him. So that was why he was there, to monitor his airway. The second day, he was stable. The bleeding had been stopped. He was breathing pretty good, and since the bullet was right there at the level of the skin, it was very easy access to take it out. It was bothering him when he was laying down. It was uncomfortable. So I made the decision to go ahead and do a procedure at the bedside, where I numbed up the skin around there, made an incision in the skin, and took the bullet out at the bedside.
And prior to removing this projectile, were you able to actually feel where it was?
Yes, sir.
Now?
You could easily feel where it was.
All right. And describe what you felt.
You could feel a very hard object that was, you could actually palpate. It was the shape of a bullet. I mean, you could actually tell the outline of what it was because it was so close up underneath the skin that you could actually see this thing poking out right there.
Right. And Your Honor, maybe witness step down. Can you show exactly where you felt this object on Officer Howard?
Sure. Okay. You want me to demonstrate on you or?
No, to the jury.
The jury, okay.
Yeah.
So you got shot on the left hand, so there was an entry site about right here, and it transversed all the way across, and the bullet was lodged around this area right here. So what it looks like it did is it came in and hit the shoulder blade and ricocheted. And that's basically what kept it from going in the thoracic cavity, is it hit the scapula, which is your shoulder blade. And when it did that, it made a sharp turn and went in and just went across that way and lodged up underneath the skin.
All right. Thank you, sir. You may proceed. Now, you indicated you performed this second surgical procedure in the room. Was
Yes, sir.
anyone else with you at this point?
Yes, sir. Actually, prior to doing the procedure, the day before, I had mentioned to the several police officers, and there was GBI that was there, that this was a procedure that I was planning on doing the next day. I told them what my schedule was for the day and the approximate time I was going to be there. When I showed up, there were several officers there, including an officer from the GBI, and they actually watched the procedure being done. As soon as I removed the bullet, I identified the bullet, looked at it, and gave the bullet to them in a specimen cup for evidence.
All right.
And then signed some paperwork about it.
This GBI agent that was present, was it a man or a woman?
It was a female.
All right. And you recall whether her name was Rebecca Shaw?
That is correct, Rebecca Shaw. Yes, sir.
And I'd like for you to view State's Exhibit 180. back, but without showing it to the jury,
Okay.
just look at it.
Just look at it,
yourself.
okay.
Yes, sir. And you recognize that item, Doctor?
Yes, sir, this is the bullet I removed.
Okay. So,
Still have rejection. Yes, foundation. I just remember, I'm objecting to the foundation because I just remember Officer Howard testified the bullet went through him. He said the bullet hit him in the left side, the exit is right
Your
side.
Honor, I'm going to object to that. That is
That's not
not
a
what he
proper
said.
response to the foundation, and I'm gonna allow him to continue.
Thank you, Your Honor. Again, do you recognize that item?
Yes, sir, I do.
And what is it?
This is a bullet, and this happens to be the bullet that I removed at the time of that surgical procedure.
Okay. And just describe to the jury how that occurred. The removal of the bullet and the bullet being given to the GI agent.
Sure. Again, they were notified that I was going to be doing this procedure, so they were there. Unfortunately, this isn't the first time I've done this, so this is something that we've been trained and something we've done before and educated in residency about the proper way of doing this, chain of evidence, having police officers present. So they were notified to be there. When I did the procedure, this officer was there, watched the entire procedure. It didn't take very long to do. Again, this was very superficial up underneath the skin, so this was a fairly simple procedure to do. It just took a few minutes to do it. Again, I numbed up the skin, made an incision, removed the bullet. As soon as the bullet was removed, I put it in a specimen cup. That specimen cup had Officer Howard's medical record sticker on it already, and it's still on that cup right now. This is the same cup that we removed, and the bullet was put in there, and it was taken by Officer Shaw for evidence.
Thank you. Your Honor, the state moves to tender State's Exhibit 180.
Any objection?
Yeah, I object, Judge, because the record will show Officer Howard said the bullet exited him. It's the record. I mean, the bullet, if Officer Howard testified the bullet shot him and it exited him, where did the bullet come from? So I would object on the ground the record will show that he clearly said it.
180 is admitted over objection.
Thank you, Your Honor. Your Honor, may the witness step down and display the bullet to the jury. You don't have to remove it from the cup, but you...
Got his medical record sticker right here. This is actually one obtained from the emergency room.
I'm sorry, you can't really testify.
Okay,
on
I
there.
just-
She can't take it down, and there's not a question.
Okay.
Just walk through, but
Okay. Everybody see it?
Thank you. Now, you were explaining to the jury what was on the container. You can say that now. At this point.
Basically, it just had his medical record sticker on there stating that was belonging to him. That was a specimen cup.
And so is there any confusion where what patient you removed this bullet from?
Not confusing for me, no, sir.
Okay, thank you. Now, were there any additional procedures that were performed on Officer Howard that you're aware of?
Yes, the oral surgeons did one more definitive surgery. The one that he did, the first surgery, was just a washout. He had a definitive surgery for the remainder of his injuries.
Okay, and just basically what did that entail?
Basically, that entailed making sure that the fractures were realigned, closure of the wounds, removing the packing that he had in his nasal pharynxes, and I think he adjusted his nasal septum to make sure that it was in the correct place. Again, the full report will be in his operative report.
Now, with respect to any trauma to the head, based on your training and experience, is it possible for a patient to suffer some short-term or long-term memory loss?
Absolutely. Any kind of head injury can result in that, and that head injury is a very difficult thing to diagnose because you can have a completely normal CT scan, completely normal MRI, and still have a head injury. Absolutely.
With regard to scarring, when you removed the site where you removed the projectile, would that leave some scarring?
Yes, sir.
Okay.
It would.
And after this third procedure, are you aware of any other procedures that Officer Howard underwent?
Yes, he actually, since I had established a relationship with Officer Howard, he had a fatty tumor that he wanted to have removed, and we did that as an elective surgery afterwards, not related to this injury at all. But since he was already on leave from work, he felt like that would be an opportunity for him to, since he already had time off, of getting that procedure done at that time. So he underwent that procedure as well.
Any other procedures related to this case that you're aware of?
As far as I know, unless he had any follow-up with the oral surgeons or anything afterwards that I'm not aware of, I don't know of any. No, sir.
All right. Thank you, Doctor.
Nothing further.
Excuse me, can I use the state exhibit, what number that was?
It's 179, 178.
It's 179, 178, 178, and 179?
Is that what you're asking?
Yes, sir. I like to use them on a little extra. I don't need to see these. Elbow, I mean. Morning, good morning, Dr. Webb, is your name, sir?
Yes, sir.
Morning, sir.
Morning.
Dr. Webb, did you do any written report on this case, sir?
I did a dictated note. Yes, sir.
How about any, is it called operator report? Are you familiar with what an operator report is?
An operative report. Yes, sir, I am.
Did you do an operative report, sir?
Yes, sir, I did.
Did you tell that jury about the operative report you done on this? Did you tell the jury about the operative report that you done on this case? I mean, on Officer House, sir.
I did not talk to them about the operative report. No, sir.
Why you didn't?
They didn't ask me.
The jury can't ask no question.
Your Honor, I would object. Argument.
Sustained.
But you did do an operative report on Officer Tony Howard, didn't you?
Yes, sir. I have a copy of it right here with me.
Okay, could you please get it out, please, sir?
Sir. Yes, sir. I have it.
Okay. Before we get there, sir, could you explain again what, how you got involved in this case?
I was the surgeon on service call that day, which includes trauma.
Is it right? Am I right? I was gonna ask if I got the podium right. Okay. Okay. I think you stated that, when you got there, you had EMS
There was a lot of nursing staff. There's some nursing techs there. There was radiology techs there. There was respiratory techs there. There was emergency room doctors there, myself, and then there was some police officers, and there probably was some EMS people around there. That's correct.
Okay. You stated that you performed thousands of surgeries, is that right?
That's correct. Yes, sir.
Have you ever took any photographs of the patient that you did surgery on?
I don't take photographs, no, sir. I don't bring my camera in the operating room.
Okay. Do anybody take photographs or any surgery? Have anybody ever took any photographs of the patient that you took surgery on?
Not while I was in the operating room with them, no, but I'm sure people have taken pictures of their surgeries afterwards.
Okay.
But I can't testify to that. I don't know.
Okay. So you would agree there have been times that your staff then took pictures of
No,
the
no,
person?
no, sir. My staff would never be allowed to take pictures. That's against HIPAA violations. We're not allowed to take photographs of patients without their permission.
Okay. But have it ever been a time out of your thousands of surgeries that somebody took photographs of your patient?
Not during the operating room that I recall. No, sir.
How about after?
I can't testify to that. If they did, I'm just unaware that I know of it.
Have you ever seen any pictures of a patient that you have done surgery on after you got finished doing surgery on?
I have not, no.
Do you mean to tell us out of thousands of patients, that you never have seen after you done the surgery, you never looked no pictures to see what you done done?
I see them back in the office. I see the actual thing. I don't need to see pictures.
Okay, what do you see when you say actual thing in the office? What you mean by that?
Everybody I perform surgery on, I see back in the office for a follow-up visit to check their incisions and their wounds.
Okay, so you don't, have you ever, the wounds, okay, you never took any picture of the wounds, or anybody took a picture of the wounds so you can examine them to see what caused the wound or what the wound was?
That's not standard practice to take pictures, no, sir.
Okay, how would you come to court and testify about the wounds if you can't tell, you can't show the jury what the wound was?
Again, that's argument.
Sustained.
How about x-ray?
Yes, sir. There were several x-rays taken.
What the purpose of x-rays?
Well, my main purpose when I walk in that room is to take care of the patient. That's my number one purpose. The reason the x-rays were taken were to evaluate the injuries that Officer Howard had sustained at that time to help save his life.
Okay, but would you feel like that necessary to take x-rays, sir?
In this particular case, it was necessary to take x-rays. Yes, sir.
Okay. And the x-ray helped you determine what a wound was and help you?
I knew where the wound was. It helped us determine the injury from the injuries that he had. You got to understand that all we see are entrance wounds, exit wounds, but and a path that the bullet takes. But from experience, bullets don't travel in straight lines all the time. They can ricochet, they can move around, and we don't know the extent of injury without assessing it. You can't just look at a person with a bullet wound or a stab wound or any kind of penetrating wound and know that their exact injuries. CT scans are very helpful in this particular case. They're not always helpful in other cases. But in this particular case, they were very helpful in identifying exactly what the injuries were.
Okay, you said exactly, and you looked at, you knew what the wound was before you done x-ray, is that correct?
We could tell where the wounds were. Yes, sir. It was pretty obvious.
Okay, pretty obvious.
Yes, sir.
Okay. You said you looked at some CDs and you examined them CDs and they were accurate. Is that what you testified to, sir?
I testified that I looked at 2 of the 3 CDs that were the ones that included injuries. It was a CT scan of the head, the face, the chest, abdomen, and the pelvis. They have a 3rd CD that's got the arteriogram and the CT scan of the spine. These are hundreds and hundreds of images. That disc was not finished loading before I came to trial, so I did not review that one. It did have the patient's name on there and the 3 studies that are on there that were accurate. These discs were taken from Athens Regional and labeled. All that information is correct. I reviewed all these studies prior to coming here today. So I'd already seen these studies prior to today.
Did you visually see the wounds on Tony Howard on March 22nd? Did you actually visual what your eyes see?
Yes, sir, I did.
Okay. Now, you were talking about the bullet path. Okay. Do you have any evidence to show the jury the actual bullet path off Tony Howard?
The bullet path was shown on the CT scan. You can see the bullet of the destruction that it did in the soft tissues, the path and the fractures. So you're able to ascertain the bullet path on the CT scans.
Well, let me see that people like.
And I'll be very honest with you, I'm not a radiologist, so I cannot read those CT scans like they can.
Well, if you can't read the CD plans.
I can read them, but I can't read them as good as they can.
Okay, if
I'm not an expert witness in CT scans. I'll go ahead and tell you that right now.
you're not an expert, why you telling the jury what path the bullet path traveling? You know,
Because I looked at those CT scans with the radiologist, and the radiologist pointed out the exact points of injury. I went and looked at it with the radiologist, and I reviewed the CT scans again with the radiologist. And that's how we practice medicine, so.
I would like to introduce State Exhibit 178, sir, and I'd like you to look at it, please, sir. Do they got the little red laser?
He does.
I mean, not that we got one. That's one for the whistle. But Mr. Mall got one. We can just change right here. They can keep there. That's what we was on yesterday.
I don't know if the other one's available or not. Ms. Davis, apparently it's on there, but that's good.
I think we started doing that yesterday, so yeah, help us all. Now, sir, you testified there's a bullet injury right there thrown out. Is that correct, sir? Let me see that.
It's a little bit difficult to see. It's not quite in focus.
Yeah, I'm trying to get that for you, sir.
I can see it on my little panel right here. But yeah, you're talking about this thing right here.
Okay.
Yes, sir, that's the bullet.
And you said that is left side?
That is on the right side right here.
I'm sorry, right here with this right here. I'm talking about right here.
It's impossible to tell if that's on the left or right side. That's a lateral view. You cannot tell. That's why we take two x-rays to tell if it's on the left or the right. This x-ray purpose is for the depth of the bullet from the chest to the back, what the depth is. You can't tell left and right in this one. That's why we do an AP and a lateral. This tells us left and right, and that tells us depth.
So they say you left, you can't tell.
I cannot tell from that one if it's on the left-hand or right-hand side.
So
That's why we have two images.
So what is this right here with this? What is this? Right there, what is that? That little circle right there, what is that, sir? Can you tell us what that is right there?
You talking about that? You talking about the bullet right there? That circle?
Okay, so is this the bullet? I don't know what it is. I'm asking.
That's the bullet. Yes, sir.
Okay. So what do you have X-ray with a bullet entered Officer Howard's on his left side shoulder? Do this show that the injury wound?
Entrance wounds are difficult. You can tell that there's swelling in the left-hand side on the CT scan, but I can tell you from examining Officer Howard and taking care of him that there was a hole on that left-hand side that had blood squirting out of it.
Okay.
That's why he had bandages on his left-hand side.
Okay.
And you're actually looking at the bandages. Those were on the left-hand side right there, wrapping up his shoulder and his upper arm.
I thought you just told her you couldn't tell if they the left or the right.
I can use common sense. I put the bandages on that left-hand side right there, so I know that's where they were.
Fair enough, sir. How about, do these X-rays show you the travel of that bullet? Just say it did the left side. You saying this?
No, you don't see the path on this. All you see, the reason this images were taken were the CAT scan people were going to tell where the slices of the CAT scans were going to go through. So this is a scout image right here, and they're going to say, I want a CAT scan from this level to this level, and then from this level to this level, this level to this level, and this level to this level, and that's how they do the CAT scans.
Okay. Now, you affirmative in saying this is the left side. There was a left side. You took that thing on the left side. You looked at it and you bandaged on the left side, correct?
There was a wound on the left hand portion of the shoulder. There was a hole to the skin, is what you're talking about?
Yes, sir.
There was an injury to the left-hand side, yes, sir.
No photographs and nothing to prove that, do you?
No, sir, I did not take a photograph. I don't have a camera to take a photograph. That's not standard of care for medicine, to take photographs.
Do you have any evidence with you today to prove that the bullet entered Officer Howard's left-hand shoulder?
What I can offer you today is my testimony that I'm the doctor that took care of him, and that he had a hole in the left part of his shoulder, and that Officer Howard told me that he got shot, and so it's under my assumption that if he got shot and there's an entrance on the left-hand side and a bullet on the right-hand side and a track that connects the two, that more than likely the bullet came from that side. Because if it didn't come from that wound, I cannot, from a medical standpoint, tell you how it got there.
Okay. You wouldn't tell this jury that Officer Howard was shot on his left side when he was really shot on his right. You wouldn't do that, would you?
He was shot on his left side. All the medical evidence points that he was shot as an entrance site, and the bullets lodged on the right-hand side.
You want to put that in your written report about Officer Howard being shot in the right shoulder, but hold on, don't look at it, please. I'm asking you a question. Don't look at it. I'm sorry, man.
You got to understand that this was.
Wait. I'm going to object to him flashing his.
No, I didn't mean it, therefore I apologize. I did not mean to do that. That's honest, I did not mean to do that. This little thing where I was talking to him, I was talking with my hand. I'm sorry.
Ask another question.
Okay, just say if this is the left side he got shot. I'm looking right here. Let's just say if it is. If he got shot right there, whenever it went straight through his neck, you see right there where that thing is? Look right here. That look like a parallel to that neck right there to me. Now, if he got shot, why didn't that bullet go through his neck?
I can give you an explanation. I don't know if you'll understand it, to be honest with you. The bullet hit the scapula, which is a bone, your shoulder blade back there. It followed a path along the part of the chest. Now, Officer Howard is a pretty big, muscular guy. He's got a lot of muscles in there. So when it hit, that bullet didn't go in a straight line. It curved around his back and went around the other way. So it did a circumferential thing. So if you have a point here and it goes around like that in a semicircle and ends right here, it lines up straight, but that's not the path that it took. Like I said, bullets rarely go in straight lines.
Okay. Do you have any evidence to prove that this bullet just went around him like that?
Yeah, he's alive today. That's probably the best evidence I have. If it would have gone straight through him, he'd be dead.
Okay. But do you have any evidence to show the travel of that bullet with you today, sir?
Send those CT scans.
Sir?
And I visibly saw the bullet wound tracking when I examined him. It's pretty obvious when you saw it.
Okay.
You could tell the path the bullet took.
Now, which way you want to be dishonest to the jury, was it?
Why would I do that, sir?
Sustained. Ask another question.
I'd like you to look at your written report, or your operative report, Mr. Williams.
Yes, sir.
Your written report says the patient is a 43-year-old African American, male status, gunshot wound to the right shoulder, Your Honor.
There's an objection, Mr. Wood.
I'm going to object from him reading from materials that are not entered in that.
Objection sustained.
Well, could you read your operative report so we can refresh your memory, sir? Could you read it yourself, please, sir?
Sure.
To yourself.
To myself?
Yes, sir.
Okay. Yes, sir.
Did you put anything in your report about Officer Howard got a gunshot wound to his right shoulder, sir?
That's correct.
Why did you do that?
Because that's where the wound was at that time. The bullet was in the right shoulder.
Did you say the gunshot wound to the right shoulder? You said a gunshot wound to the right shoulder, didn't you? Didn't you?
The right shoulder was wounded.
Okay. You said a gunshot wound, listen, a gunshot wound to the right shoulder, didn't you, Your Honor?
Ask and answer.
Sustained. Ask another question.
Well, Judge, I'd like to move into evidence, Dr. Webb, officer written reports about this gunshot wound to the right shoulder, sir.
Can I clarify something, sir?
Just a moment.
Okay.
You want to see the report? Is there an objection?
Yeah, I just need to see the report. It may already be entered in all that.
Yeah, okay.
Where am I at on this?
Can you, is that the exhibit, the medical records? What exhibit is that?
States 117
look through here as he continues.
Does it appear that the records are already admitted?
I think it is, but, so we can continue.
All right.
If possible, Your Honor, I would like to introduce this as my defendant's exhibit.
No objection.
All right. What
Then I
number?
was gonna ask you what we, am I on, cause two of my, cause you said.
16.
Number 16?
Is that just one page or is it the entire?
No, it's just,
record?
it's just a piece of, oh, they're too much. I mean, they got the same thing. I mean, since you said that, you know. While I'm doing it, I can get, he wrote another offer report.
Let's just do one at a time.
Okay.
So far, it's been,
Okay, I'll just do this one, don't worry about it. You already know, Jeff, don't worry.
so where's the one that you're asking to admit? Okay. You want me to identify that?
Yes, I'm asking you.
Show it to Mr. Balkadoff first, please. You may proceed.
Ms. Wells, do you
Yes, sir.
recognize what you see in this defendant exhibit 16, sir?
I do, yes, sir.
Is it fair and accurate, presentation of what you wrote in your report, sir?
That is the report I dictated, yes, sir.
Okay. Your Honor, I would respectfully tender this into evidence exhibit 16, sir.
Any objection?
No objection.
It's submitted.
Can I see that? Since he has one.
Are you asking to display it?
Yes, sir.
Jury?
Yes, sir.
All right.
Mr. Webb, sir.
Stop the web.
I mean, Dr. Webb, sir. I would like for you to look at defendant exhibit 16, sir.
Mhm.
Isn't it true that this exhibit says the patient is a 43-year-old black American male, status, host gunshot wound to the right shoulder? Is that correct, sir?
That's correct.
Okay. Bullet still stuck in the right superior aspect of the shoulder, just above the scapula, below the skin, and the elected incision. GBI is bedside for retrieval of bullet.
That is correct.
sir?
Yes.
Do that explain why y'all don't have no pictures, because y'all want to just leave the jury with your testimony today?
I understand what you're trying to, I understand what the misleading.
Excuse me, Dr. Webb, this is
Your Honor, I don't mind if he asks questions, but I'm going to object to this commentary, this misleading commentary. If he wants to ask him a question, I have no objection.
I'll sustain the objection, so to ask the question without commenting on the question.
I didn't think I would comment. I thought I would
Ask the question, please.
Now, is this your, did you sign that? Let me see. Did you put your signature on that down there? Did you sign that?
I did, yes, sir.
What day did you sign that?
Looks like the 24th?
That's March 24th, 2011, is that correct?
That's correct.
And that's military time, 1453, and what would that
That'd be 253.
At 253, you put your name on that, didn't you?
Yes, sir.
You didn't have nothing in that report in your, now, that March 24th, 2011, what's the date that is?
To about March 24, 2011?
Yeah.
That's the date that you're talking about, that's the date it was uploaded to the computer system.
I'm asking you what today's date is today.
Today's date?
Yes,
Today?
sir.
It's 2015 today.
What the date?
The date is July 1st, 2015.
July 1st, 2015. Okay. And on March 24th, 2011, you put that report about Tony Hawk being shot in the right shoulder, is that correct?
You're getting something confused here. You got to remember, this is an operative report about the side that we're doing the surgery on is the right side. There's a very big problem at the hospital on wrong site surgeries. We have to specify right versus left. His injury that I was addressing at this time was on the right side. That's where the bullet was. That's where the injury was at. And my operative report has to address where the injury is that I'm addressing at that time. I was not addressing anything on the left-hand side. If you read my history and physical from when he came in, that describes the injury to the left side. I'm only dealing with the bullet site on the right-hand side on this particular thing. So the indication was for the injury that he had to his right side. I can't put left on there because I wasn't operating on his left side. I put left on there, then I get in trouble. This is for, and that is a JCO, which is an organization that governs hospital for wrong site surgeries. And if I don't address the right on this and the surgeries I'm doing on the right, then I'm not practicing medicine the way I'm supposed to. So you're reading the right-hand side because that's the area of injury I was addressing. Wasn't addressing the left-hand side at this time.
Now, then you tell the jury that you visually looked at them wounds.
I visually looked at the wounds. That is correct.
Isn't it true that you put right-hand side because you visually saw right hand?
The bullet was on the right-hand side. That's the side I did the surgery on.
I'm talking about this wound you put in your report, sir. You said gunshot wound, didn't you?
There was a bullet there. There was a wound there. There was a gunshot wound. I think you're getting confused. He had wounds to his right and his left shoulder. I think you're getting lost in the terminology, sir. His right shoulder was injured and his left shoulder was injured. I operated on his right shoulder that day.
I think I'm reading all this report, sir. That's the only thing I'm doing. I can't be confused off what I'm reading.
Again, I'm objecting to this comment here.
I'll sustain the objections, argument, and to ask another question.
Okay. Sir, did you put anything in this report about the left shoulder wound?
I was not addressing the left shoulder at this time, so I did not put anything in this report. If you want to refer to his left-hand side, you can look at my history and physical and the rest of the medical record.
Again, according to this report, we looking at this defendant, Exhibit 16 that you wrote. Did you put anything in this defendant, Exhibit 16, about a left side gunshot wound?
I wasn't operating on his left side that day. It was irrelevant to this procedure. This only applies to the procedure I was doing at that time. This is a very small portion of his medical record right here.
No further questions, sir. And read all of it.
And the lights on, redirect.
Yes.
Collect the exhibits, please, Ms. Davis. Including exhibit 16 as well. Mr. Hood, can you hand her 16 as well? Yes.
Thank you. Now, in the medical records that have already been tendered, as states Exhibit 172, also as Defendant 16.
You can Elmo or laptop? What do you have?
Elmo. Now, this has already been tendered States Exhibit 172, and it was just shown to you as Defense Exhibit 16. I'm not sure you were given an opportunity to adequately explain what that first sentence refers to. What does the first sentence refer to?
Basically, those couple sentences is the reason why I'm doing the surgery. That's indications for the procedure. He has a wound to his right shoulder. It was from a gunshot wound. It does not mean that that's where the bullet entered in at. I was operating on his right shoulder. I did not include any other injuries he had in his entire body, including his face, his left shoulder, anywhere else. This was only pertaining to the right shoulder. The indication for that surgery was to operate for that particular wound, and it was to remove. And the reason I put foreign body on there is that's for coding. That's how our coder is built. We don't have bullet as an ICD-9 code. We have a foreign body. So the reason for that is for coding. A lot of this report is drafted through regulations of the hospital, how we do surgeries, and for billing and reimbursement purposes.
Okay. So this procedure is not written for court or evidentiary purposes.
No, sir.
Is it?
No, sir.
Okay. And at any time prior to removal of that bullet, did you observe any hole on the right side?
No, sir.
Okay. Now, also in the medical records, States Exhibit 172, you indicated you authored another report.
Yes, sir, the history and physical.
And do you recognize this particular report?
Yes, sir, I do.
Okay. And did you write this report as well?
I dictated this report, yes,
Okay.
sir.
And under the physical examination,
Yes, sir.
did you list where the entrance wound was?
If you look under the shoulders and back, actually, I used a little pointer right here. Shoulders and back, it says upper shoulder has an entrance wound to the left upper shoulder with a palpable bullet on the right side with hematoma and contusion, which means basically bruising and a collection of blood. There's no midline point tenderness to the spine, meaning that he didn't have any evidence of spinal injury in that area.
All right. And is this report accurate?
Yes, sir, that is accurate.
And is this report in any way conflict with your other report?
No, sir, it does not.
Thank you. No further questions.
Any other questions?
Just briefly.
Turn the lights on, please.
Sir, you said you needed thousands of these reports, right?
Yes, sir.
Okay. What I'm confused about that, why didn't nobody write on photographs so it couldn't be no argument about left shoulder, right shoulder?
Ask and answer.
Sustained.
Okay.
You know what you were coming to testify today, right?
Yes, sir.
Okay. What I want to know, why didn't you tell the jury about your written report when you were testifying first? Why you failed to mention this? Why?
I have several. I brought this with me today in case somebody asked me about it. This is all my written reports. I'll be happy to answer any questions you have in these written reports. But I reviewed them as being reports that I've written. And there's several other reports in here that other doctors have written.
Exactly.
I'm only going to answer the questions I'm asked, sir.
So, but right now, we have no clear evidence of how that bullet traveled from the left side to the right. Is that correct?
We have CT scan reports. You have my medical experts witness. Everybody agreed that I was an expert in this particular field. My expert opinion is that bullet entered into the left side and lodged on the right side, and I could feel a palpable track of the exact path because it was very superficial. I can't say that for the facial wound because you can't palpate that. We had CT scans that detailed the facial wounds of what they were. But I can go ahead and tell you that from looking at the CT scans and looking at the evaluation of the patient, that I feel 100% comfortable that the bullet went on the left-hand side and lodged on the right-hand side. And if it didn't do that, then I have no medical explanation of how that happened.
Could you show us your record? What you just explained to me, could you show it from your record that you wrote?
My history and physical was just put up there. That's what I wrote. Entrance wound on the left and bullet lodged on the right-hand side. I don't know what else you need to know from that, sir.
So I thought you said that X-ray couldn't tell us. We couldn't see it on the X-ray. Then you state that you couldn't tell us
On the plain film, you cannot see that.
So we have no visual evidence today. No, we have no visual evidence that the traffic path of that bullet, is that correct?
You have my testimony
Visual
as an expert.
evidence.
No, you do not have a visual evidence. If you would like to slog through the hundreds of films on the CT scan and see the bullet tracked on that, that would give you some visual evidence, but I can go ahead and tell you that you probably won't understand what you're looking at, and the jury, unless they have medical knowledge, probably will not understand what they're looking at. Because those are very detailed images that are very medically specific of what's going on. Without knowing the anatomy of the human body, it's going to be very difficult to tell what they are.
How do you know the jury don't have no knowledge?
I don't know that. I said unless they have medical knowledge.
You just said we probably couldn't understand. How could you possibly know what we can't understand without showing us?
I don't know. That's why I said probably.
Are you a psychic as a doctor too?
Objection.
No further questions.
Anything else, Mr. Buckrow?
May you be excused.
Any objection?
Subject recall, regular doctor, that's just subject recall.
Make that down. Break. I'll, jury go to the jury room. 10-minute recess.